Sometimes I forget I have vitiligo until someone is staring at me, and then it dawns on me they're looking at my hands.
It is absolutely a myth that only African Americans develop vitiligo, though being white patches, it is more obvious on people with darker skin.
Sometimes people, they want to ask questions, but they just don't know how. I will get through the feeling that I have about having vitiligo with the support of my family and my friends. I'm 54 years old. I live here in the Detroit metropolitan Michigan area. I have one daughter, Kyla, and she's amazing. And I love to dance. Dancing soothes my soul. Ballroom dancing is something that I love to do. I have been doing it for over 20 years now. When me and my ballroom partners go out and dance, we are having a wonderful time.
Our whole family is just dancers. So her love for dancing is rooted in our family.
When we get together, we do karaoke, we play Uno, we play Jenga.
Music and dancing is probably the biggest part of our get-togethers. It allows us to hang out and kind of be around each other. We're big on just being happy, having a good time.
In 2014, I was living in Denver, Colorado at the time, and as I was putting on my lipstick, I noticed where the lipstick did not adhere to the corners of my lips. So I took it off and I did it again. And I pretty much self-diagnosed myself and I was nervous. I immediately made a doctor's appointment and went to go see the dermatologist, and she confirmed it. My name is Shanthi and I have vitiligo.
The signs of vitiligo are white patches of skin anywhere on the individual's body. We certainly do get many patients who associate lightening of their skin and getting white spots with Michael Jackson and calling it the Michael Jackson disease. There are a number of causes. Genes play a role in it. About 1 in 100 people have vitiligo in a normal circumstance. But if you have a first-degree relative with vitiligo, then you have a 20% chance of developing the condition. If you have an identical twin with vitiligo, your risk of developing vitiligo is only 3% more. So clearly there is a lot more to developing vitiligo than just the genes.
There is not a family history of vitiligo in my family, to my knowledge.
By far the biggest factor is autoimmunity. In vitiligo, the attack is against the melanocytes, which are your skin color cells.
Vitiligo is my third autoimmune disease. I have Graves' disease, interstitial cystitis, and I have vitiligo. So, yes, me and my autoimmune diseases, here we are.
It is absolutely a myth that only African Americans develop vitiligo. Vitiligo affects every group of people equally, though, of course, being white patches, it is more obvious on people with darker skin because of the contrast.
In the African American community, we already have to deal with colorism. So to know that my skin is becoming lighter, that alone affected me because I've always loved my skin color.
Vitiligo is usually just diagnosed through examination, coming in, looking at someone's skin and seeing typical white patches in the typical locations. But there are some times that it can be a little hard to diagnose. It can be, beige, and there are other skin conditions that cause some of that lightening of the skin.
My dermatologist in Denver put this ultraviolet lamp up to my lips and had me turn to the left, turn to the right. And of course, I didn't have on any lipstick that day. And that's how I was professionally diagnosed. At the time, it didn't have a traumatic impact on me because I purchased tubes and tubes of lipstick so I could easily hide it. In 2021, I noticed a spot on my right thumb. From that moment on my thumbs, it just started moving into other different places on my body and hasn't stopped. My vitiligo is going to continue to spread. Once it started on my thumbs a few years ago, I take pictures every 2 or 3 months of the same spots, and I compare my pictures from a few months ago. I pretty much can look in the mirror and tell if it's a new spot coming. Anywhere in my body, I'm pretty knowledgeable that there's a new spot coming.
Vitiligo likes to go to areas of friction, areas that rub against things a lot. So like the fingers, also areas of movement. So the corners of the mouth would be an area similar to that. Around the eyes is another very common area, the genital region. Vitiligo progression is totally unpredictable from one person to another. If it's not treated, we don't know whether it will get worse, get better, or stay the same, because the main driving force is your immune system. Early treatment in vitiligo is really important just because it's easier to treat vitiligo when it's new. The first goal of treatment is to stop the vitiligo from spreading. If it's effective in doing that, then the next goal is to bring the color back. So in terms of vitiligo treatment and management, there are medical approaches, there are creams that one can apply, there's light treatment that patients undergo, there are certain oral medications that are used to treat the condition as well. Because we know that the treatment response is slow and it's not guaranteed to bring patients' color back fully, makeup or cover-up is really important for patients suffering from vitiligo.
Sometimes I forget I have vitiligo until someone is staring at me, and then it dawns on me they're looking at my hands. So those are moments when I get really emotional about having vitiligo, is when people stare. People that have just met me have asked me, was I in a fire? And they'll take my hand and look at it, and that's when the tears will fall. Some days I try to pretend that it doesn't bother me, but every time I go in the restroom, I go wash my hands, boom, and there it is.
So the emotional burden that can come along with having vitiligo, it can be tremendous. They have a higher divorce rate. They have an increased incidence of sexual dysfunction.
I personally have found that vitiligo has been a subject for some family members of mine to not discuss it. They won't bring it up.
I was too afraid to ask her anything about it because I didn't want to offend her. And I didn't know how she was dealing with it either.
Diamond and I had a talk a couple of weeks ago. And Diamond asked me questions that no one has ever asked me before. And that made me feel good because sometimes people will talk to me and I can tell they want to ask questions, but they just don't know how to ask.
We were just having a very random conversation, and I just ended up asking her if it was okay to ask her about it. And she said, yeah. And from that moment, we just had a very raw, open, and honest conversation.
When you have people that support you, you know that you're not going through it alone. My mom goes to a retiree center, and it was a young man down there, and we both saw that we both had vitiligo. He told me that he was in a support group and welcomed me to join the support group. I took his advice, and it's been amazing.
because there's so much power in just people who can relate to one another coming together and having shoulders to lean on when they're feeling weak, being inspired by those who are more accepting of their condition. And then when we're able to combine the medical perspective, the facts, with the stories and the feelings that vitiligo causes in the people that deal with it, that's when we're really able to make a huge impact.
Dr. Huggins is amazing. In our support group, he's interested, and when he asks us questions, when I answer personally, he listens to my entire answer. I don't feel like I'm being cut off.
I hope that people see the value of seeing specialists for their medical conditions when you're not getting the results that you're hoping for from a general practitioner. Make sure you're going to someone who has a lot of experience in dealing with your condition. They may be able to pass along really valuable information and treatment recommendations that can be really helpful for you. So I think we continue to improve patient outcomes by really trying to be comprehensive in our approach to treating vitiligo. There are multiple treatments that are in the pipelines for the future.
I love my aunt. I love her so much, and I'm extremely proud of her. She has learned the ins and outs about what's going on with her. And then she's able to educate me, other people, on vitiligo.
I'm definitely hopeful for the future. I know that this is just a stumbling block for me, and I know that I will get through the feeling that I have about having vitiligo, and I will do it with a smile on my face and with the support of my family and my friends.